And as part of this, we've seen a very big spike in community transmission. The state's death toll has risen to 5 overnight after a woman aged in her 70s died in a Victorian hospital. The specifics, including which hospital and whether the woman had any pre-existing conditions, are unknown, only that she did have COVID-19. She was in a Victorian hospital and had been for at least a few days. The Health Minister, Jennifer Makakos, paid tribute to the woman and said her thoughts are with the family. Take a listen.
In losing a fifth Victorian, my thoughts are with this elderly woman's family. It is a very stressful time for family members who have an unwell member of their family in a hospital, then to be worried about COVID-19 as well. And I have to stress again, this is a very serious situation, unprecedented in all of our lifetimes.
Victoria has ticked over 1,000 cases of COVID-19 overnight. We're currently sitting at 1,036, I should say, confirmed cases of COVID-19. That's up 68 from yesterday. A big spike in community transmissions, currently sitting at 57 when just yesterday it was only at 39. 6 people are in ICU and a total of 36 Victorians are in hospital with COVID-19. About 400 people have recovered. Now, the state government has finalised its agreements with the private sector to add hospital capacity, bed capacity to the healthcare system. 400 nurses also have been taken on by the state government to undertake contact tracing in confirmed COVID-19 cases. We've also seen about 4,000 former healthcare workers, so former doctors, former nurses, former paramedics, put their hands up to return to the front lines. APRA, the regulator, currently working on their certification at the moment to make sure they are able to practice. Now, as we are seeing this big spike in community transmissions, the state government here has altered its testing criteria. The focus now no longer on incoming international travellers who are confined to hotels. It's now focused more on the community, and so people who do have that more community-facing jobs, who have more contact with the community as a whole, including healthcare workers, police, disability workers, are being given a priority to tests.
I can't be more grateful for those people who are putting themselves at the coalface with this risk that is apparent. Not all of the healthcare worker cases that we've had have picked it up through working in healthcare settings. In fact, the majority have picked it up outside of the workplace.
Now, the Health Minister wouldn't say what the exact threshold for moving closer to stage 4 restrictions in Victoria is, only that this spike in community transmissions does bring us closer.